Hi viewers, welcome back. In today's topic, we are going to talk about the principles of management. So, when we come to principles of management, we have to remember fayol. He has given us 14 principles of management, where we are going to talk about the managerial function according to 14 principles. So, when we have a management, this management has to be followed through these 14 principles. So, the first principle is discipline. So, when you have an organization, you have to follow some sort of discipline. The discipline will be a set of rules and regulation that the organization has formulated, and this discipline must be followed from the different level of organization. And then we have unity of command. Unity of command is the command that is given from the higher authority to the lower authority. So, unity of command. So, if there is an instruction, imagine you are getting your principal is saying you next week will be declared as a holiday. Okay. So, then the top level management has decided that you will get an holiday for the next week. Then the middle level management. So, middle level management, who is there in the middle level management? Your HODs. So, your HOD, your community HOD comes and tell, no, next week holiday cannot be declared because like our income requirements are incomplete. So, now next week if they are not going and if they are not finishing their requirements, from the coming week onwards it is going to rain and we cannot have our home visit. So, that is our difficult part. Okay. So, this from the middle level management, the tutors, they go and communicate with the students. So, what the students will tell, no, please do not cut our vacation. So, we will finish our requirement before we go for vacation. We will finish all our requirement, we submit our file and then we will go home. So, there will be a negotiation. So, what happens? So, the students will communicate to the low level management, and the low level management, that is the tutors, they communicate to the HODs, and HOD what they will tell, okay, so in case if they complete their requirement, they will have their vacation. So, what there will be a negotiation, and with that information she will go to the top level management. So, she will go and tell the principal, see ma'am, the requirements are incomplete. In case if this requirement is submitted, then they can go for vacation next week, or otherwise let them stay home in the college only, let them finish their requirement. So, that will be there like the way of communication. So, once the command is passed from the top level management, that has to be followed till the low level management. In case if it is not possible, you must have a solid reason to explain why it is impossible. Okay. So, that is your level of command. And then is the unity of direction. So, unity of direction is when you are going to your college entrance, you can see your notice board. So, you will have the principal at the top level, vice principal, HODs of different departments, then you have the associate professors, assistant professors, then you have professors, tutors. So, you will have, so that is like the command will be passed from the higher level to the lower level, and that has to be followed. Okay. So, that is your unity of direction, and then subordination of individual interest to general interest. Okay. So, individual interest. So, my record finishing is to the general interest, is to the college name. So, before I go to the university, I have to finish my requirements. So, when I finish my requirements, I can submit it to the university, to the college for examination. When the college is taking me to the examination, it meets the university requirements. So, it is like your individual interest becomes a general interest. Okay. So, when I take care of my patient, so it is my patient today, tomorrow my friend's patient, but ultimately what is the aim? Taking care of patients. You have to cure the patient and you have to send the patient out of the hospital. Okay. So, that is your individual interest to group interest. And then remuneration of the staff. So, that is like payment according to the work that is being done. So, however the people are working, nurses are working, so they have to be paid, doctors are working, they have to be paid. So, this is like you are paying according to the work that is being done. Then centralization. Centralization is in the sense like everything has to be organized from one particular area. That is like when you are getting instruction from the principal, Only principal will give instruction. Then vice principal must not give another instruction, then the HODs must not give different instructions. So, one centralized idea, and that has to be followed by other peoples of the department. And then we have scalar chain or line of authority. So, line of authority, again it is the same thing like from your top level management to the low level management. And then the next principle is order. When some instruction is given, some order, some rules are placed, it has to be followed. So, you cannot reject any rules or any principles, like you cannot avoid something, okay, according to my comfortability I can't do anything. So, when you are working under a management, you have to follow the rules and responsibility of the particular management. And then equity, that is like everybody in the organization has to remain the same, okay, no partiality in the organization, no caste, greed, color, you can't follow anything inside a management, everything has to be same. And then stability of tenure, so that is like now I come and work in the organization, when they want, they are making me to work for 2 years, and now they don't want, so what they will do? So, now the student strength, this year the student's strength is very less, so sending the particular staff out of the organization, that cannot be done. So, when you are taking a staff, it is like the organization, if they get patients or not, the staffs are to be there. When there is a heavy load of patient, the staffs take care of that patient also. So, that has to be taken care. So, tenure of stability, tenure stability must be provided. Okay, initiativeness in the sense, it is not only doing whatever the top level management is telling, it is like my initiativeness for the development of the organization, for the improvement of organization, for the improvement of the students, what is my interest, okay. So, it is like my work, it is not the hospital telling, okay, morning one time you have to take care of the patient, like catheter can be changed like only after 7 days, okay, today is the 7th day, tomorrow, no counting days like that. My initiativeness, I have to prevent infection to the patient, so I have to take care of the patient, so I have to be responsible. So, initiativeness to do some activity for the patients has to be taken care. Then we have esprit de corps. So, what is this esprit de corps? It is a major principle, that is like the unity of the workers or the employees. There is no groupism, there is no partiality, there is no division among the members. All are working together for the same organization or for the same benefit, okay. So, that is your unity of working. So, that is your all the workforces are working together for one success. And then we have specialization of division of labor, okay. So, you know, when you are being placed, so you are a BSc staff, then you will be placed in a particular department. GNM staff, the responsibility of the GNM staff will be different, and MSc, and the responsibility of an MSc staff will be different. So, according to the educational qualification, according to the experience, according to the your previous exposure, all these things you have to provide division of work. And then authority with responsibility. What is this authority and responsibility? Authority is like I am supposed to do something. Responsibility is I am accountable for something, okay. See, now a patient is admitted with breathing difficulty, okay. So, what is my responsibility? I have to make the patient survive. So, what is my responsibility? I am accountable for that patient's life. So, what I have to do? I have to provide oxygen, I have to check the saturation, I have to position the patient, I have to see whether there is, I have to auscultate and see whether there is any fluid secretion, so whether there is any aspiration, all these things I have to detect. So, that is my responsibility. So, what is the authority? Authority in the sense I have to tell, okay, why are you standing inside? You all can get out of the room, only patient with one attender can stand inside. I must have some rules for giving medicine. If I want to give an arsal nebulization, I must have an authority to provide a nebulization, okay. So, and like a responsibility without an authority is useless, okay. So, I must have an authority as well as the responsibility of taking care of patient, then only my work will be complete, then only I can do something good for the patient and for the society. So that is with your 14 principles, where we have seen discipline, unity of command, unity of direction, subordination of individual interest to general interest, then remuneration of the staff, centralization, scalar chain or the line of authority, then we have order, then we have equity, then we have stability of the tenure, initiativeness, then esprit de corps, then specialization or the division of labor, then the authority with responsibility. Hope you understood this 14 principle. So let us talk with some other topic in the next class. Till then, take care. Bye.